How does interoperability
improve healthcare? Interoperability, it's a complex word, people say it a lot, but really it's about how do we make sure that information can be shared seamlessly between one healthcare provider to another healthcare provider, and also importantly that information is shared with patients, consumers, individuals. FHIR is a game changer when it comes to interoperability standards. What FHIR is a way of describing the content, the clinical content that you might want to exchange between systems. So if there's medication information around what medicines I'm actually on, that information can be shared between all of those providers, and that information be understood by the clinician, the software system, and me as an individual. And that's why we need those standards within healthcare. But FHIR is also a really good standard for how do we address problems and challenges at a population health level or a surveillance level, and how do I exchange and support that information that's required for something like antimicrobial resistance.
I've always been very much fascinated by bacteria in particular and their ability to evolve and mutate and survive in a really harsh environment, which is essentially what happens when they're in an environment such as a hospital, which is flooded with antibiotics and antiseptics. So I lead the digital solutions for AMR team here at the Australian eHealth Research Centre. And a flagship program is the HOTspots Disease Surveillance and Response Program. The HOTspots program is a digital surveillance and response program that monitors and responds to antimicrobial resistance. It's a whole selection of diseases that can be caused by viruses, by bacteria, by fungi, which means that the solutions we need to find for these diseases, for AMR, need to be region-specific, they need to be precise. We need to know which pathogen we're targeting and which antibiotic will be the best antibiotic for that pathogen. In my early 20s, I acquired a multi-drug resistant infection and I had to have 3/4 of my kidney removed. So a major surgery very early on in my life. I remember the fear of thinking there might be absolutely no antibiotics that the doctors can prescribe to treat this. And that sort of stayed with me. So my personal story really drove me to research AMR.
FHIR actually provides the structure of the way that we can actually share the medicines information or the pathology results or the condition information. It provides that very clear way of describing that clinical content and also the mechanism of which we can share that content between those systems.
So our work at the eHealth Research Centre contributes to this consistency. What we're looking at is a standardised set of clinical terms so that when data is recorded in one place and in a different place, the same terms are used, and so computers can understand that the same information is being recorded. The tools that we're building assist in this process because they make it easy for software vendors to work with these standardised vocabularies. So the particular clinical terminology and international standard we engaged with was called SNOMED-CT. SNOMED-CT is a large collection of clinical terms. It covers both diseases, procedures, medications, and a number of other areas. Associated with SNOMED-CT are a lot of rules and things that you need to know to be able to use it properly. In response to this, what we implemented was a software system called Ontoserver that encodes all those rules. So you can have a very detailed, precise clinical vocabulary, and we can find it very quickly. So this makes the clinician's task of recording precise, accurate data much, much simpler.
How does interoperability
improve healthcare?
That's how.